where the focus is going to be 80% on wellness visits and 20% on acute care, so that these employees and their dependents can still come in for a sick office visit, for any of these urgent care type visits, but the focus will be on wellness with health coaching, with helping our members manage their chronic conditions to bring their numbers in line where they're stable. So with that focus with wellness, we're going to focus on hypertension, diabetes, managing cholesterol, asthma, arthritis, tobacco cessation, and obesity. And all of these are lifestyle-related conditions that we see are impacting the cost to the city's plan. And so this would be available to all employees and dependents since their claims are driving the plan. I wanted to give an example here of how these lifestyle-related conditions are impacting the cost of the plan. And so this is a report that we have presented to HR and to Finance, where we looked at 2014 and 2015 claims for the city, and we compared those to benchmarks. And so the benchmarks, when you see here, your claims compared to the norms are going to include employers of a similar size, employers within the Southeast region, and then employers of other city and county municipalities or state and local governments. So here we see for specifically diabetes, you see that our number of patients that are being treated for diabetes as a primary diagnosis is above the benchmarks here. So it is impacting the cost of the plan, and our average paid per patient is above benchmarks, 18.32% above benchmarks. Total paid out for the plan for those that are being managed for diabetes is actually 44.43% above benchmarks. So again, the goal here for someone with diabetes is to help them manage this condition, help them manage the expense of that and their out-of-pocket costs, and also the out-of-pocket expense to the plan, through identifying them early, providing them the proper treatment measures, and impacting their lifestyle to bring their numbers back in line. Also looking at obesity and heart disease. So the chart to the left here is going to be for obesity, where we see the number of patients with a primary diagnosis of obesity. We are 43.59% above the norms, above the benchmarks, and the number of patients we have being treated for obesity. And then for heart disease, that chart to the right, we're 10.45% above the norms for the numbers that we're seeing treated for heart disease. We know with obesity, that's not going to be everyone that would be included in the obese category that is a member on our plan. That is only the members that are being treated for it currently. But we know that in turn, obesity is going to impact these other health conditions with type 2 diabetes, chronic heart disease, and hypertension. And that the CDC says that medical expenses for obese employees for an employer plan are on average 42% more than a person of a healthy weight. So again, these are lifestyle-related type conditions that we're looking to help manage through the wellness program. And then also for asthma and COPD. While we're below the benchmarks on the number of patients with a diagnosis of asthma or COPD, you see that we're well above the benchmarks in the average paid per claimant on the plan, 53.87% above the benchmarks, and then total paid in a year, we are 32.87%. So again, that would be focusing on tobacco cessation, helping these members become healthier and manage their conditions through the wellness program. So how we're proposing the wellness program would be structured is, one, providing a impactful financial incentive to participate in the program. Because if we don't provide an incentive to participate, then we're going to not touch the members that need it most. And we're looking to reach out to those that are not receiving regular medical care, that don't have a relationship with a primary care physician, so they potentially have conditions that are going undiagnosed and are uncontrolled. So with that, we're looking at two options for the incentives. One would be a surcharge for non-compliance with the wellness program. With that, we would expect to see 90% or more participation on this plan in our experience. because that impacts every employee if it's a surcharge on top of what you're paying to contribute to participate in the medical plan. The other option would be to fund credits through a health reimbursement account when you comply, and that would be used to offset the deductibles on the plan. And so we're proposing that compliance with the with the wellness plan would be different steps. The first step would be to complete your biometric screening. So go through a regular physical with either within the Health and Wellness Center. You can go to your own primary care physician if you choose, where you're going to go through and have that blood draw and evaluate your numbers. The next step would be that you complete an online health risk assessment that normally takes 15 to 20 minutes to complete. It's going to ask some questions about how much physical activity do you have, what types of food are you eating, how much sleep do you get, to evaluate your overall health. And then based on the results of your biometric screening and your health risk assessment, then the wellness vendor would stratify the risk of the population. So those that are deemed high risk based on the results would need to see the health coach within the Health and Wellness Center until they're released. So normally the requirement to see a health coach is a monthly basis that you would go in. You're going, say if you have high blood pressure, they're going to check your blood pressure. They could prescribe you medication if you want to take that route to treat it. You can receive that medication within the Health and Wellness Center, or they'll give you other alternatives, be it through nutrition, be it through exercise, to bring your blood pressure back in line. And then, so if you are not high risk, once you complete the biometrics and the health risk assessment, there's no further requirement for you to see a health coach. It's up to you if you'd like to. If you have some concerns, we want to get healthier, you can see the health coach at your own discretion. But only those that are high risk would be required to see the health coach in order to be in compliance and avoid any financial penalties. For 2017, we are proposing that this wellness program, the incentives, would only apply to employees and not spouses at this time.
Quick question. Was
Yes.
that health coach, is that a doctor or a PA or a nurse or?
It's normally a nurse or a PA, I believe. I'm looking to our clinic vendor to confirm that.
Could be a nurse, could be an exercise physiologist,
Okay.
someone skilled and trained in lifestyle coaching.
All right. Just curious. Thanks.
For the financial incentives, we're looking at the option of the surcharge, where we would propose that an impactful surcharge to incite participation would be $50 per pay period if you're not in compliance, so you're not completing the biometric screening, the health risk assessment, and then coaching if necessary. Or through the HRA dollars, where someone would receive $500 in the health reimbursement account credit to offset their deductible. And you would receive the different levels, $100 for completing the health risk assessment, $200 for your biometric screening, and then $200 if you're high risk and you're required to participate in coaching. If you're not high risk, then you would have you would automatically receive the additional $200. So these options will be vetted with an employee focus group and with the Employee Benefits Committee to evaluate which option may be best for your employee population and may most impact participation for this plan. We did want to provide a case study for a county government that has had an on-site clinic with an integrated wellness plan in place for the last 3 years. We did review the return on investment that they've seen from their wellness plan utilizing an actuarial firm. And so just some background on this, they do have 900 employees. This program's been in place for 3 years, and they do incentivize participation through the wellness surcharge. Their surcharge is $80 a month if you are not in compliance. Same requirements with completing the biometric screening, health risk assessment, and coaching if you're high risk. So they do have very strong participation in the plan because of that strong financial incentive. This group has realized the incremental savings that the city's already seeing by utilizing a on-site health and wellness center, where they generated $51,000 in savings through office visits, so comparing to retail costs versus what's done within the health and wellness center. And then their employees were realizing $262,000 in savings with no copay. So we want to keep that in light, that a lot of the savings is not only for the employer plan, but is also for the employees by not paying for these services within the center. Their lab work generated $33,000 in savings, and then the medications dispensed was a $171,000 savings in comparison to what retail cost would have been. But in addition to those incremental savings that they're seeing for services and for prescriptions, they're also seeing an impact to their high-cost claimants and to the health of their members on the plan. So this group saw a 40% reduction in the number of high-cost claimants that they had. So this is going to be any claim that's over $50,000 in a year. And they saw a 36% reduction in the cost for those high-cost claimants. If we saw a 36% reduction in the cost for Columbus's high-cost claimants, that would be $1.2 million in savings if we realize that same advantage of a wellness program. Half of this county's high-cost claimants in the prior years were related to heart conditions and heart disease. So we know that the major factors contributing to those are those that we will be focusing on managing within the wellness program. So high blood pressure, diabetes, high cholesterol, smoking, and obesity. And some of this is difficult to measure for an avoided claim on the plan. So some of this we have to look at. We're impacting members' health, and we did evaluate that through aggregate data on the biometric screenings and the health risk assessment to see we did see a reduction in overall blood pressure levels. We did see a reduction in the number of those members that were classified as having diabetes, and we did see a reduction in those using tobacco products. So we saw an impact in the members' health, and so part of that we have to tie back to avoided cost on the plan, and we look at benchmarks where Milliman says that the cost of a heart attack is $72,000. For coronary artery disease, to treat that is $75,000 in a year, and for a stroke is $61,000. So these are the type of expenses that we're looking to avoid in our high-cost claimants in the coming year by focusing on managing these conditions. Next, we're going to look through the specifics on the plan design options. So we mentioned earlier that we are looking to streamline the plan options where we currently have 3 plans: the Health and Wellness Center plan, the HMO plan, and then the POS PPO plan. We are looking to go to a silver gold plan design, which is in line with benchmarks for what most city and county governments are putting in place at this point, and even the state, you'll see, has those metallic tier plans. One, to assist with education and the employees making decisions on what plan may suit them best as far as their out-of-pocket expense on the plan in comparison to their payroll deduction costs for that coverage. And so with this, we're looking to have both of these on the open access POS network, where there's no requirement to see a specialist to get a referral from a primary care physician. The main difference in these plans is going to be the out-of-pocket expense to the member. Since they're all utilizing the same network, and both plans, these members will have access to the Health and Wellness Center if they choose to go there. So the silver plan does have a $2,000 annual deductible for any one individual, maximum of $4,000 for a family, but any one individual in the family would only have to meet the $2,000 deductible for that plan year. Once they meet that deductible, the plan would pay 80%, and they have 20% coinsurance, and then leaving that out-of-pocket maximum where it currently is on the HMO and the POS plan at the $6,350. Still no cost for services for office visits within the Health and Wellness Center, so the member would have no copay there. Primary care physician office visits would be a $30 copay, and then specialist office visits would be a $40 copay. Emergency room care would be $200 copay on the silver plan. And then for prescription drugs, we're still proposing no cost to the members if you're receiving your prescriptions within the Health and Wellness Center. For a retail pharmacy, it's a $20 copay for Tier 1 prescriptions, $40 for Tier 2 and $60 for Tier 3. So that is the current plan design that we have. So no proposed changes for the prescription drug copays. The Gold plan will have a bit of less of an out-of-pocket expense with a lower deductible and lower co-insurance to the member. So it has a $1,000 deductible for an individual, maximum of $2,000 for a family. After the member meets the deductible, the plan pays 90% and the member's paying 10% of the cost. Same out-of-pocket maximum at the $6,350. This plan would still have no copay for the Health and Wellness Center office visits. Your primary care physician copay is going to be $10 lower on this plan than it is on the Silver plan, so a $20 copay, and then specialist office visits would be a $30 copay, and emergency room care would be a $150 copay. This plan also would have their prescriptions available to be dispensed at the Health and Wellness Center, again at no cost, and then if they did choose to go to a retail pharmacy, it would be the same copays that they're currently paying on all three plan options. As a part of evaluating the proposals for 2017 with the new plan designs and with the expansion of the wellness plan and the Health and Wellness Center, a big part of that is the decision for budget and how does that impact our budget. As you've seen, we did see a savings in our costs for the plan from 2014 to 2015. So the plan has run well. The cost-saving measures that have been put in place have been effective. But there has been an issue with how projections were made in the past for the cost of the medical and prescription claims. Looking to the future for fiscal years, we've seen that for calendar year 2016, it was projected to be a 5% increase in cost, and we realized a 15% increase. And so we've seen that that has, year over year, caused this plan to be underfunded. For fiscal year 16, we were $2.19 million underfunded. And so what that has meant is that CCG has had to fund that difference on the back end in order to keep the plan whole. So when we structure these contributions based off of a projected dollar amount and set that at 70-30 split, that has ended up being more like 83% contribution from CCG because of those additional funds that have had to be put into the plan on the back end. So Shaw Hankins has used a true actuarial modeling tool that we've had a lot of success with. We see this same scenario in a lot of city and county governments where we've come in, the plan's been underfunded, and when we've utilized our actuarial firm to make that plan right, the first year we do have to realize an increase to contributions into the funding of the plan. But once we do that, we can realize that the plan will start to build reserves and be stable for the future. So we're using that actuarial model to accurately project the cost and to review the entire claims history with the data that we have and appropriately fund the plan. And so that modeling does indicate that we need a 23% increase for the plan year 2017 with the projected claims expense and administrative expense with the health and the pharmacy benefits. So with that, we did evaluate, as I indicated earlier, that the way the contributions were set with the plan being underfunded, the set budget was a little over $5,000 at a 70-30 split for CCG to contribute, but for fiscal year 16, the cities actually had to contribute $6,510 per employee, so that is an 83.4% contribution from CCG, so that has greatly varied from the 70% goal that was set. For fiscal year 17, we are budgeting $6,100 per employee. So for the proposed plans at a 70% contribution, that's right at that $6,100. So that does mean there will be an increase in the employee contributions that we're proposing here. I did provide a separate handout that compares the current contributions or payroll deductions for each of the plans to these proposed contributions. So first you'll see we have the active employees and then the pre-65s. The active employees, this is based off of the 70-30 split, where we see that silver plan is going to be the lower cost plan option. So for single coverage, it would be $73.03 biweekly. For employee and spouse, it's $137.29. For employee and child or children coverage, it's $127.82. And then for an employee and family, it's $202.31. The gold option is where the employees are going to pay the difference. So that means the city's paying the same dollar amount for the silver plan as they are for the gold plan. So the employee pays the difference to have a lower deductible and less out-of-pocket expense. So for that gold plan, it's $104.65 for employee coverage biweekly. For employee and spouse, it's $196.74. For employee and child or children, it's $183.19. And then for an employee and full family, $289.90. And then for the pre-65 retirees on a monthly basis, we're looking at the retiree coverage, $263.72 on the silver plan. For the retiree and spouse, $793.26. Employee and child, $738.53. And then the family, $1,168.90. The gold plan, they would pay the difference there. $332.23 for the retiree, $922.06 for the retiree and their spouse, $858.42 for the retiree and children, and then $1,358.67 for the retiree and family coverage. We did, Pam provided me with an evaluation where it was reviewed for each pay grade. The proposed pay increase would cover the cost difference when you compare the Health and Wellness Center, which is the lowest cost plan now, to the silver plan. That 2% pay increase would cover the difference in the payroll deductions for every pay grade for employee-only coverage.
Do we have a breakdown of how many of our employees are taking which level of coverage in terms of employee spouse? Do we have that? I think that would be interesting to see, because it's great to say that it's covered, but if we've got 20% taking employee only, we're impacting a lot of folks. I'm not sure there's anything we can do about it, but I just think we ought to know.
I have that by plan. So for the Health and Wellness Center plan now, which is our lowest cost plan, we have 474 employees taking employee-only coverage, 73 employees taking employee and spouse coverage, 198 have employee and child coverage, and then 109 have family coverage. For the HMO plan, we have 561 that have employee-only coverage, 86 have employee and spouse coverage, 257 have employee and child coverage, and 136 have employee and family coverage. For the POS plan, we have 180 that have employee-only coverage, 38 that have employee and spouse, 107 have employee and child coverage, and 72 have family coverage.
Thank you. Hold on, we've got a question. Councilor Allen.
Do you have the premium cost that they're currently paying? I see the page that shows what they're going to with the increase. How does that compare?
There was a separate handout that has current cost. It's outside of the book.
Okay, thank you. Thank you, sir.
Yes, sir. Thank you. Oh, I'm sorry. Councilor Thomas?
I have a number of questions. The first one is, and it may be that Ms. Hollowell can answer this one. I'd like to know what role our Employee Benefits Committee played in the development of this plan.
Councilor Thomas, since FY16, we have talked to the Employee Benefits Committee about a health care master plan. So what you're hearing today has already been in general, talked to the Employee Benefits Committee. The specifics of today's meeting has not been reviewed with the Employee Benefits Committee. That's the thing that we want to do after we leave here. But the general specifics in terms of opening the Health and Wellness Center up to all employees, that's been vetted with the Health and Wellness Center, with the Employee Benefits Committee. We have talked to them about going from 3 healthcare plans to 2 healthcare plans. We've talked to them about the general specifics of this several meetings ago.
Well, I guess my frustration at that is that this committee was set up to help in designing the health benefits program. And it would seem to me that the Employee Benefits Committee should be more intimately involved in dealing with these questions, in dealing with these issues. Were they in agreement with the changes and the increases and all of the stuff that's been presented here today?
At the time, Councilor Thomas, we did not have the increases in hand to be able to talk to the Employee Benefits Committee about the specifics of the cost that we are discussing today. However, the general concept of what we're discussing today has been shared with the Employee Benefits Committee numerous times. They have urged, as well as other employees have asked us about, and we've heard it around this table here, employees have asked, can we go to the Health and Wellness Center? But we've said no because we have this plan, and unless you're on this plan, you cannot go to the Health and Wellness Center. And that's one of the things that we're doing now. We're opening it up to all employees, and they don't get a penalty whether they go or not go. They can continue to go to their primary care physician if they want to, and the Health and Wellness Center is an option. It's an option for every employee, no matter what plan that they're on.
And
yes,
I will tell you, Ms. Hollowell, that the reason that I'm asking about the employee health benefit, I don't doubt what you're saying, and I know that there have been those conversations, but those conversations should be being held, I believe, specifically with the Employee Benefits Committee as we're designing this, and I'm just disappointed that they're not playing a larger role in this. Let me ask another question, and Mr. Chair, you may need to answer this one. I am assuming that this plan will have to be approved by council. And how will we, I guess, go about doing that if we approve, what do we approve in order to accept this program? It's not, I mean, is it in a particular part of the budget that we would have to deal with it, or how would we go about doing this?
There's a couple components that's part of the budget that has to do with this plan. One is the healthcare fund and the revenue sources for the healthcare fund, which includes the employee premiums and the employer contributions. So the budget is built off of a $6,100 contribution per budgeted position. So as adopting the budget, you're adopting this plan. The specifics of...
So wait, let me stop you. So if we adopt the budget that says $6,100 per employee, then we're adopting this plan that provides for that $6,100?
That's correct. The portion that will come back to council is what they're talking about with the health risk assessment account and whether we go to incentivize wellness. That portion will come back separately from the budget.
Okay.
But the employer contributions and the employee contribution is the basis of the budget.
And the basic plan designs, any changes in the designs themselves.
Yes, sir, that's correct.
So if we approve the budget, we have approved the changes in the level of contribution for the employees and the changes as they apply to the two plans now having different deductibles. I think the out-of-pocket's about the same, but
Right, and that would be part of the budget ordinance, would be the plan design, the contribution for the employer and the employee would be part of the budget ordinance.
And did I hear you say that this surcharge for noncompliance idea will be a separate
That would be separate.
decision and discussion by council?
Because that will need to go back through the Employee Benefits Committee and have continual discussion about that component, which I don't believe will take place before the budget ordinance is adopted. So either the financial incentive or the financial penalty will not be in the budget ordinance. It would come back separate.
So I guess my question then is, how does that portion of the plan impact the $6,100 contribution?
Well, and Deputy City Manager.
I think they've got the framework of the plan put together, and what they're still deciding on is how to create incentive to get folks to use the Health and Wellness Center. They've done away with the Health and Wellness Centers as a separate plan. They now have created an opportunity for us to continue to positively impact our claims on the back end by getting more folks to use that clinic.
Well, I guess my question it really goes to the fact that, as I understand what you were saying, the surcharge is $50 per pay period. That's $1,300, right? So we need to be real clear that, that's part of, that $1,300 is part of whatever it is that we're doing to and with our employees. In the case study that you gave us, can you give me any kind of idea of a percentage of employees that did not comply and therefore had to pay the surcharge?
On that group, we see 90 to 95% participation where they're not receiving the surcharge. Because we are putting in such a substantial surcharge to incentivize that participation, the majority of those employees are participating. And we're making it easy to participate by providing the on-site biometric screenings, providing them the time to participate in those, and then access to the health coach on a monthly basis.
And you said in the material that you presented to us that at this point, the recommendation would be employee only, not spouse and family?
Yes, at this point, we're only recommending to implement this with employees and then look to roll out to the spouses in the future.
And family?
Normally, we only roll out to those over the age of 19 to participate in a wellness program.
Okay. Then one of the other questions that I have, in the plan options, the silver plan, let me see which page I'm looking at. I'm looking at page 19.
Yes.
As I understand it, the silver plan is comparable to the HMO numbers, is that right? And the gold plan to the PPO, generally? I mean, the numbers, or is it the other way?
The silver plan's going to be more compared to the POS, and the gold plan compared to the HMO.
Okay, I guess my question then is, the silver plan of the, is the only one that the deductible increased. Can you speak to that? What the others are all, except that for the others are all stayed the same, but that one went up.
The silver plan would be an increase in deductible regardless of what plan you're on now. And then the gold plan would only be an increase in deductible if you're on the Health and Wellness Center currently. That plan has a $500 deductible.
Right, okay. And you said that one of the reasons that, or one of the things that Shaw Hankins has done to determine the premium for this year is to use the actuarial model. Did we not use that last year?
Not that I'm aware of. I'm not sure that the prior consultant used a true actuarial firm to project their claims. It appears that they may have done some calculations in-house that may not have been as accurate as what you receive when you're using a national actuarial firm.
And so I guess when I have conversations with my friends out in the community who says that their health insurance plan at their company went up 30% or was proposed to go up 30% this year, the corresponding number for CCG plan is 23%?
It's 23%
Is that right?
increase.
Okay. And then just one other thing, I want to make sure that that I remember correctly. Several times in the last couple of weeks as we've been talking about this, it's been said that we realized $1.8 million from Muskogee Manor leaving the plan. Am I remembering incorrectly? Didn't Muskogee Manor pay $1.8 million though? I mean, they paid for their employees, right? So isn't it sort of a wash?
Their claims were higher than their fees. So that 1.8 million was just a direct removal of what their claims were. As far as what they were contributing, I'm not sure of that exact number, but
So you're saying they didn't pay the 1.8 million for their claims?
We would have to look at the revenue that they contributed and the expenditures. I think what this is saying, that part of the reason that we saw that reduction in claims is because Muskogee Manor left the plan. So you kind of have to pull that piece out. Even though it's a savings to the city, there's also a reduction on the revenue side as well. And when we went back and looked, they were close in some years, the city, because they were paying a kind of a insured rate to us, we assumed the risk, which is part of the discussion that we had had many
Right.
times, is if they went over what they paid us, we were responsible for that. But I think that savings that she represented, it was just a reduction on the expenditure side, on the claim side, not necessarily a balance.
So are you saying we paid $1.8 million of their claims?
No, that's not what we're
Okay,
saying.
say it again then.
So what we're saying is if the expenditures were 13.8, when we take Muskogee Manor out, they become 12 million. So when she's showing our reduction in claims, part of that is Muskogee Manor that really needs to come out of the picture to compare apples to apples. So when we're showing our claims difference, that 1.8 was related to Muskogee Manor, which is not in the equation this year.
Okay, so we're talking in this instance only about the claims. We're not talking about the amount that went into the revenue stream,
Yes.
if you will, that went into paying those claims.
That's correct.
But Muskogee Manor did contribute to that revenue stream some amount of money.
Yes, ma'am, that's correct.
Okay.
And just for clarification, the way I understood this incentive program where they're either going to be penalized by some sum of money that they pay, or they are going to receive some money deposited into a health reimbursement account to help offset that. Either way, it's designed to offset the impact on the claims of whether or not they migrate to the health and wellness center, right? Because if we're charging them, logically, the claims are a little higher than they would have been because they're not going to the clinic for sort of a maintenance kind of deal.
Right, so you're correct. We're incentivizing them to go to the Health and Wellness Center, one, for that incremental savings where we see the lower cost for an office visit compared to retail, but then also for them to participate in the wellness program where we're identifying any conditions on the front end and helping them manage those.
Well, and I don't know, we've got some discussion, I'm sure, to engage in with regards to some of the cost of the employees, but I certainly applaud the opening the option of the wellness center or the clinic to both plans. I can't imagine when my kids were little, if they had a sore throat, being able to take them somewhere, get an antibiotic, a generic antibiotic prescribed and not pay a nickel. I mean, that would certainly, I think, appeal to a lot of those individuals. So anyway, Councilor Allen, did you have any questions? All right, well, I think Okay. I think that's all the questions.
I just want to make one comment, too. Part of the basis of this plan is to continue with the 70-30 contribution strategy that council has adopted. So the premiums that are set and the employer contribution is based off of that 70-30 strategy.
Yeah, and I'll be the first to admit I'm guilty of oversimplification, and I think when we thought about the 70-30, we were talking about the actual, we failed to, I think, factor in, I did, the impact of additional claims to those premiums. So, I mean, yeah.
One last thing I wanted to mention, hopefully for clarification, Councilor Henderson, in terms of the incentive options, the surcharge or the HRA dollars.
Yes, ma'am.
Where someone has the option to do the biometric screening, the health risk assessment, and you stated that we want to drive employees to the Health and Wellness Center, and that's just it caught my attention because it's going to catch employees' attention.
No,
because what they don't want to do is be driven somewhere.
Right. No,
And I know you know this.
You're right. Poor choice of words, and I apologize.
I know you know this, but they will have the option
Right.
with going forward, they will have the option of going to the Health and Wellness Center if they want to. If they want to go to
Right.
their primary care physician, the person that they've been going to for however many years, they certainly get the option to do that. But they are incentivized, hopefully, to go to the Health and Wellness Center because, you know, they're not going to have office visit co-pays. They're not going to have the prescription co-pays. So they are well incentivized to go to the Health and Wellness Center. But I don't want them to think that this is another attempt to drive
You're
them to
right.
the Health and Wellness
No,
Center.
and
They go
actually,
if
the
they want to.
biggest benefit of that to me is that they're going to be healthier.
Oh, I know.
Because they're going to have an opportunity to have somebody who's invested in and takes an interest in their lifestyle and some of the changes that they're struggling with, and it helps to have a coach. And
Absolutely.
so you're exactly right. I stand corrected. I apologize.
Absolutely. And
Poor
just
choice
the
of
last thing, in our discussions here today, the employees will ask probably 3 questions. Am I going to have to change my doctor? No. As a result of the changes that we're proposing, you're not going to have to change your doctor. Am I have to go through too much red tape in order to see a specialist? No. This even takes away more of that red tape, if you will, if you want to see a specialist. So if you're seeing a specialist, your child needs to see a specialist, they'll still be able to do that. Am I still going to be able to get the drugs that I've been able to get, my prescriptions? Am I still going to be able to get those filled? Yes, you'll still be able to get those prescriptions filled that you've always been able to get. So those are, a lot of times it's very basic for employees, and I want to make sure that they understand that, yes, these are big changes, they are proposed, but the things that they've been able to do, the basic things of being able to see their doctor, see their specialist, get their prescriptions, they're still going to be able to do those things.
Yes, ma'am. Councilor Allen.
Thank you. Ms. Hollowell, how should we approach, I share the concerns that Councilor Thomas said about the Employee Benefit Committee not being aware of exactly what you presented today. How do you plan to get them involved, and what's the timeline?
Absolutely. Well, this is early May. By end of May, I'm hoping that we've had at least 4 to 5 employee meetings. As soon as we leave here today, we have a meeting already scheduled with the Employee Benefits Committee, so we'll be meeting with them, but we won't limit it to meeting just with the Employee Benefits Committee. We'll also be having focus group, because this is a lot to swallow. It takes time, and we really want to be able to vet the wellness incentives. As been stated, we want to vet those 2 options with the employees so that we can come back to you and say to you as a council member, this is what the employees have said that they feel comfortable going forward with. And there are a lot of questions, I know. So yes, by the end of this month, hopefully we'll have already had at least 4 focus group meetings. And we intend to have meetings all the way up to open enrollment, which will happen in October. We are bringing online, as you know, a new wellness center vendor. So we want to get that vendor acclimated to the employees so they get comfortable with them. They'll be going out with the team as well. So we'll be having numerous focus group meetings, not just with the Employee Benefits Committee, but departmental meetings and meetings in different locations and different places where employees have questions. We'll be posting this information on our website this afternoon, so it'll be posted there. And as we get more information, as questions come about, Q&As, we'll be posting those, so the employees, a lot of times, they're going to have the same questions, so we'll be able to post that on our website as well.
Okay, thank you. Thank you, sir.
Yes. Counselor Thomas.
One last question, Ms. Hollowell. Even though we're doing this as part of the FY17 budget that takes effect July 1, this plan does not take effect until January 1 of 17, is that correct?
That is correct.
Okay.
So we've got a
So there'd be
while.
plenty of time if, for whatever changes are
Yes.
finally done, for the employees to be fully aware of what's
Yes,
there.
absolutely.
Okay, thank you. I just wanted to make sure that's...
Thank you, Ms. Hollowell.
And just one thing, too, to clarify, when we're talking about a 23% increase, that takes into account that we were 15% underfunded in prior years. And as you can see from the presentation, we come back after the fact at the end of the fiscal year, and we have to increase the contribution per employee, which really makes the city's contribution, the employer contribution, closer to 83 or 84% than the 70%. And so this really puts the plan at 70-30, and the 2% cost of living adjustment helps absorb that impact to get us in line with the 70-30, and to also account for the increase in healthcare costs.
Okay.
So next on the agenda, we have community reinvestment. Laura Johnson, the division manager for community reinvestment. And what we're passing out to you is the C100, the line item detail for both CDBG and the home program, so that you'll have that as Laura is going through the reorg. And if you have questions specific to the CDBG or the home program, she'll be able to answer those questions.
Good afternoon, Council.
Good afternoon.
Sorry, my allergies are messing with me. I'm here to present to you the recommendations for the fiscal year 2017 budget for community reinvestment. First off, I kind of want to go through a little bit of what we do in community reinvestment. We administer the community development block grant and the home investment partnership programs. What we do is we ensure compliance with all federal regulations, and that's done by us ensuring that we're funding eligible projects and programs every year. We also do contract management, so when we enter into a contract with a subrecipient or developer, we ensure that they're complying with all federal regulations as well. And then we also do monitoring during the projects and continued monitoring after the projects. We also manage the city's real estate program to include all property acquisitions, dispositions, leases, so on and so forth. This next current year, the city is going to be allocated $1,328,478 in CDBG funds, $644,801 in home investment partnership program funding, and then we have allocation of $145,717 for the real estate. For the community development block grant, administration is capped at 20% of the overall allocation. So basically, this year, the administration for CDBG funds is capped at $265,695. So this year, we have in the budget a total of 76. I'm looking at the C100 form. We have a total of $76,711 allocated towards demolition. We also have $20,000 allocated towards an affordable housing development program to assist with doing ADA compliance for the disabled, for like handicap ramps, grab bars, and so on and so forth. We also have $766,800 allocated to the Section 108 loan repayment This is the last year for that payment towards that loan. So next year, that $766,000 can be allocated to other types of programs because it will no longer have to go towards the Section 108 loan. We also have the public service programs. Those are our subrecipient programs. They are like homeless programs, Meals on Wheels, and those types. That is capped at 15% of our allocation. HUD will not allow us to exceed the 15% cap. So this year, our cap is $199,272. We also have our Home Investment Partnership Program funding and the C-100 form for that. Home is also capped at 10% for admin, so we cannot utilize any more than 10% of the current year. So Home's next year admin cap is $64,480. We also have new construction allocated next year, $350,000. That'll go to NeighborWorks Columbus to construct 3 new homes for low-income home buyers. We also are allocating an additional $131,444 to the tenant-based rental assistance program. That program, we work with Open Door Community House to provide rental vouchers to the homeless. So currently, they're serving 15 individuals. We hope to increase that by 5 additional individuals, and this program will provide rental assistance for up to 2 years for each individual. And then also, the home program requires that we allocate at least 15% of our home allocation to a community housing development organization. Currently, NeighborWorks is our only CHODO, and so they will be awarded $96,288 to construct 1 additional new home for a low-income household. The reorganization of community reinvestment was actually recommended by the transition audit that was conducted on the division for us to restore the department to restore it from a division to departmental status so that we can adequately be organized and staffed to perform all required aspects of each program to include the monitoring, inspection, and determination of participant compliance throughout the tenure of each project. Because what the HUD requires is even though we're allocated funding, and even though we go out and put funding on projects and programs, even after all of that, there are certain restrictions placed on those programs. So like if we give NeighborWorks a house or money to build a house, once they build a house, our job isn't done. We have to still continue to monitor that house for an additional 15 years. So we have to every year ensure that whoever's living in that house is low income. And so those are things that HUD comes back and looks at us every year when we're being monitored to ensure that we're monitoring our past projects to ensure that they're still compliant. This is the current organizational chart for community reinvestment. And as you see, we have myself as the division manager and 3 full-time employees. 2 community reinvestment tech 2s and 1 community reinvestment tech 1. The next slide is what the recommendation is as far as restoring it back to departmental status, where we would have the director's position. Under the director's position would be the community reinvestment planner, a financial manager, a community reinvestment program manager, and 2 coordinators. In order to do this reorganization, I've identified funding from the current year's budget and funding that's already out there and available that has not been utilized in the past. So basically, we're able to use the 2017 admin funding from CDBG Home and the real estate to fund some of the positions. We also have a grant called the Homeownership and Small Rental Housing Program Grant. We received $400,000 from the Department of Community Affairs to build 2 duplexes in Bellwood. NeighborWorks will be constructing those duplexes, but the city is allowed to maintain $20,000 to do the project delivery cost on those. So that's to pay us to still do the environmental reviews, review drawdowns. We have to actually go in and draw down the money from DCA and stuff, so we're able to keep $20,000 for that. We also have $258,000 in home admin rollover. This is funding from fiscal year 2011, 2012, 2013, 2014, and this current year, 2015, that has not been expended in the past. Home is one of the programs that actually allows you to roll over admin. CDBG does not allow you to roll over admin. Also, currently, we've identified approximately $247,000 of CDBG program income. What CDBG program income is when we purchase a piece of property utilizing CDBG funds, or else we tear down a house for demolition and put a lien on that property. When the city is repaid funding, HUD requires that funding to go back into the CDBG allocation. So once it goes back into that allocation, it's considered program income. Technically, when you utilize CDBG funds, you're supposed to go in and draw all of your program income before you use entitlement grant funding. We have identified approximately $247,000 that has not been drawn, and we're able to allocate 20% of that towards program income, or towards administration. So our current funding that we have identified as program income, in any year following that we receive program income, 20% of that can be used for admin. Also, one of the things that we have not been doing in the past is when we do a project, HUD allows us to charge our administration or salaries, and they call them project delivery fees or delivery cost. And what they are, so like if we do a housing rehab, we're able to charge some of our staff salary where they're going out and doing the environmental reviews, they're going out and doing on-site visits, going out and doing inspections of the homes, Davis-Bacon, Section 3 compliance. All of that can be charged to the project, so it doesn't necessarily have to hit the admin cap. So if you're spending $100,000 on a home, you can take 10 to 20% of that and actually charge salaries to that project. So those are identified as project delivery costs. And also in the project delivery costs as well, we're able to charge salaries to disposition. So the city currently has, I'm not sure the exact number, but a bunch of CDBG property. That's property that the city owns, but it was acquired with CDBG funds. So for us to market that, we can actually pay a portion of somebody's salary to market those properties and try to sell them. What happens, though, is when we sell the CDBG properties, then it's counted as program income. It goes back into program income, and then 20% of that can be used for admin. So those are just different ways that we're able to allocate funding to hire additional staff and to have additional administration funding. This is stuff that you can do every year to increase that cap. So as of right now, as projected for next year, we have about $769,221 that is eligible to be used for our administration costs.
Does that cover the reorganization that you've outlined?
Yes.
The only question I would have is, I mean, listen, I'm sold that you guys do an amazing job and you touch so many different things, and you're about the only thing the only department that we have that really goes out and aggressively and actively tries to improve communities and identifies partners with which to do that. My only fear, what happens is there a chance that some of these might not materialize? Because I know you're talking about the 20% of any program income, and you identified some that hadn't been expended, and that was $49,000. Well, what happens if that's expended and then that 20% and allowed? It's the same questions I have when we get grants and they're applied to organizations that are going to add people. Because you desperately need the reorg and the personnel, but I just want to make sure that on an ongoing basis that those funds are there, because that's a lot of moving pieces.
Yeah, it is. Basically, you have to kind of be creative with your funding every year. I just wanted to give an example. I mean, all of you know I'm from Albany, and I came from their Community and Economic Development Department. They actually have they receive less entitlement than we do, but they receive a little bit more program income because they have a lot of loans and all that they service, and they get that money back. So their allocation is probably $200,000 more in CDBG than ours just because of the program income, but then their allocation for home is less every year. But with that, they've been able to maintain, for the last 10 years that I know of, 11 employees in their department.
Really?
Yes. Currently, they have 11 that's funded by CDBG, and they have 1 that's funded by home, so it's really 12.
And that's just by working within the percentages and guidelines that are given by HUD?
Yes. And, basically, that 769 will not be all utilized this next coming year.
Right.
The home funds will continue to roll over until we use them all. This year, we've only approximately $373,000 of all of that funding that we've identified would be utilized this year, this next coming year for administration.
Okay. Counselor Thomas?
I want to, currently, the chart shows that you have 4 full-time employees, right? Go back
Yes.
1. 4
Yes.
full-time employees. Okay, and then in the next chart, we add a part-time and 2 full-time, right?
Correct. We would basically be, one of our technician positions, the Tech 1, that position is going to be reclassified to a part-time admin position, so it'll no longer be a full-time position.
Okay.
The 2 technician positions, the Tech 2s, those are the 2 positions there that are seen as the coordinator positions. Those are just being reclassified to a coordinator position rather than a technician 2. The 3 new positions, well, one of them is a position that is going part-time, but the 3 ones that are new is the planner, the financial manager, and the program manager.
Okay, I want to make sure with Ms. Hodge, as I'm looking in the in the notebook that you gave us, on page 93 is the personnel, and it only shows 1 additional recommended position in the CDBG fund. The home fund shows the same number. Am I just missing, are these, well, I guess my first question then is are these positions that the administration is recommending adding to the department?
One is real estate. One of the positions is going to be funded out of the real estate, because on top of this community reinvestment, doing the administering the CDBG and home programs, we also administer the real estate for the city for general government property. It's not property that's CDBG or home funded properties.
And the real estate comes under,
That position is listed on page 90 under community reinvestment. That's actually a position that's funded out of the general fund.
okay, but that's not a new position. It says that we currently have that position.
That's correct.
So,
So that's 1, and then under CDBG, which is on page 93, would show 4, so that makes 5, and the home would make 6 and a part-time. So it's really a reclass of a full-time to a part-time and then adding 3 full-time. So in essence, you're adding 2.5 part-time.
I guess the bottom line question is this configuration what the administration is recommending that we do, that we add these full-time employees?
Yes, ma'am, that
We
is the
make these
Are they in the budget?
reclassifications and add them.
Are they in the budget?
Yes, they are included in the budget.
Okay, I couldn't make these numbers work, and I just wanted to make sure that we were all together with that.
Right, and I think that it was difficult to try to explain because they're not, it's really percentages of positions in different funds to make the whole position. And so it's not really CDBG and it's not really home, it's community reinvestment, and this is the big picture. But the funding sources are split between those allocations that Ms. Johnson kind of covered.
Great, thank you.
All right, and just a couple more questions. One, I noticed that, Ms. Johnson, and this is probably for the deputy city manager, but I noticed, it may be semantics, but currently it's the manager Community Reinvestment Division, and is that going to director status? Does that include a step increase?
Yes, that includes a change in that position from a division manager to a director, which was also recommended by the internal auditor
Right.
when they did their review.
And the only reason I'm all for it, I tell you, we hold her ears, we get more out of her than we put in her, I promise you. But another thing, though, I just remember how we ended up getting to this position, because as CDBG funds were cut and there were other limitations placed on the availability of some of these funds, we were kind of forced to really gut this department. And the fact that we're still getting so many positive things out of it just amazes me. So I'm glad to see us try to restore it. I just want to make sure that, and I think we do have the right person who's been able to identify some things to be done within the guidelines that we're given to fund it. So,
And I think that's what Laura has brought to the table, is the creativeness that's needed to run this division and to utilize the funding sources in order to accomplish more with what we have.
and just two other questions. One's kind of simple. You mentioned we only have one CHODO left. I don't know why I thought we had one over in the Winton area, maybe the Winton Area Network, or
Winton is not a CHODO.
they're not. Oh, okay.
Yeah, they actually are just a nonprofit housing developer,
Okay.
and they get regular home funding from us.
Okay.
They chose not to apply this year, and it's only because they already have prior year funding that they need to spend, so they're a little bit behind, so they made the choice not to apply for funding this coming fiscal year.
Okay, and that Section 108 loan, are there restrictions on how that funding is going to be able to be allocated?
No, once that's back into the pot next year, it's the same as it is now, where basically we're allowed to use 20% of the entire allocation to administration. Only 15% can be used for public services. You have to utilize 70% of all CDBG funding to benefit low and moderate income. So it's not limited on the types of projects, but you just have to ensure that the low and mod are being benefited from the money.
Right, and I know we have greatly reduced the amount of demolitions we've been able to do, and I don't want to go tearing stuff down across the city. The objective is to try to rehab it, but one way or another to clean it up in the shortest amount of time. So I guess we could put some of that money to beef up our demolition?
Basically, demolition is capped as well. CDBG funds only allows you to spend a maximum of 30% of your allocation on slum and blight. So even though we have more money out there, we're still capped at that 30% for slum and blight. So it may increase a little bit, but we can't just allocate all of it to like demolition. We would have to make sure that we don't go over that cap.
Yeah, it'd be.
Yeah, so this year, though, just to kind of give you an idea of what we're doing with some of this funding that we found from prior years that has not been expended yet, we came to council a few weeks back to get approval to do $300,000 to parks. So we're going to do some park renovations at Theo McGee, Britt David, Benning Park, and I'm trying to think of the other one. Oh, Pop Austin. Pop Austin's going to be an ADA for ADA for children, special needs children.
Great.
So that's some of the things that we haven't been doing in the past that we're able to do with CDBG funds. I just don't know that it was ever recognized that they're eligible. But just to give you an idea of some things that you can do with CDBG funds is you can do park renovations, you can do rehabilitations to recreation centers, you can do infrastructure projects, sidewalks, road improvements, as long as they're in low-income neighborhoods.
I think that would be a great exercise to maybe get you here one day, separate event, and I don't mean lumped in with 55 other updates. I mean, get you here for a work session and let us know, because you've brought a fresh perspective to this and an understanding that we haven't had before.
Right.
And I'm encouraged that there's so many different options, and you touch so many different areas of our community. I think we ought to sit down and kind of make sure we understand that.
And Mr. Chairman, we'd love to do that. You may remember at an earlier council meeting, I was telling you how lucky we got to attract Laura McCoo Johnson And I was sharing with you that she has done some amazing things. She brought an understanding of HUD regulations. She brought a relationship with HUD officials that we've never had in this government when it comes to CDBG home program. And I feel it as she talks about it because it's amazing.
Yeah.
And so you know that I think we had as many as 9 employees in CDBG home at one time. And we reduced the staffing down to about 4. And the previous director was concerned about the funding, and that was one of her motivations to say, I'm going to take something else. And then we went for a year or so with an interim, and then we found Laura McCool Johnson, and things have changed since she joined us. Again, creative, innovative relationships, understanding that we've never had before.
Great.
And we're lucky to have her, and we'd love to come back and
I think that'd be a great exercise to
share.
go through. Councilor Barnes.
Yeah, you have, Laura, I was just dovetailing. City manager's taking a lot of what I was getting ready to say. But Isaiah, when Joe went over here, it was at the director level before, wasn't it? I remember we did gut this program, because I remember it was, I forget her name, who was a director, then Joe and a number of other individuals. But yeah, there were about that many people prior. Am I wrong or am I right?
You're absolutely right, Counselor.
And it was at the director level. I mean, we gutted things.
We did.
We gutted this program.
We did, and what we are hearing today, that she went back and pulled records, obviously, and you heard her mention today money from 2011. She just,
We lucked up.
Yes, she's been phenomenal with it. And again, when you've got the relationships and you can go to Atlanta or make the phone call and they're telling you, yes, that's, I mean, it just makes a difference. So, yeah, I just don't know how to word it any.
No, well, this is.
And I don't want to use that as being critical of those who came before her, but she just brings a different level of understanding and relationship.
Thank you. Thank you, Councilor Barnes. Councilor Davis.
Well, Ms. City Manager, that does concern me somewhat, and I know it does you, but that's okay. I mean, I personally have always thought that you could only use it for certain items. We've always talked about that, and I know we're using the word public services now, and I'm not sure what all that entails, but I'm glad that there's a better understanding of what exactly this funding can and how it can be used, which is good. So I think it's probably new for all of us, if I may. So with that being said, Ms. Johnson, if you would just provide us real soon with a list of all the line items what the funding will be used for.
Okay.
And that's kind of customary, what we always ask for, and I believe those decisions have already been made and they're within the budget, so.
Yeah, we're currently under our consolidated plan preparation and our action plan preparation for HUD. Those plans have been on display since April 1st, so we had to have all the information in the plan to put on public display on April 1st. We did have our public hearing on the 28th to go over our action plan and to receive any additional comments that we may have gotten from the public. We did have a few comments, and those have been put into the plan by our consultants. That action plan and consolidated plan will come before council on May the 10th for final approval. But we will give you a copy of the line item budget, as you know. That's in the action plan.
Is this action plan something new that we're doing now?
No, it's brought before council every year around this time.
Okay.
Yeah, HUD requires that we have this plan submitted to them by May 15th of every year.
Okay. If you can just get that list to us, preferably before the meeting.
Okay.
Thanks, sir. Councilor Huff.
Good afternoon.
Good afternoon.
I was privileged to attend all 3 of her community meetings, and they were well attended, and she provided so much information. I had to come back each night just to ask more questions. Some things apply to specific areas, but in general, it applied to everyone that attended the meeting. So I just wanted to publicly say thank you, and piggyback with the city manager to say how lucky we are to have you. As they all know, my learning curve continues on and on and on. I wake up every day trying to learn something new. And I was just amazed at what you can do with a little bit of money. You know, you're taking monies and saying, okay, I can only use a certain percentage, but this is what we have accomplished. So thank you, and I will continue to ask questions and learn a little bit more. Thank you.
You're welcome.
Thanks,
I'm here
Sarah.
for whatever questions anybody has.
Laura, thank you very much.
Next on the agenda is John Hutchison with Inspection and Codes, and he'll go through the fee increases that are proposed and recommended in this budget.
Good afternoon.
Good afternoon.
Run through these pretty quick. Kind of during the interim period and now into the full period, there's been a couple of questions about fees that come in that I get from contractors and developers and architects and everyone else. So I kind of took this as a time to address some of these issues where we got them. Like I said, the three main ones we want to look at is a residential demolition fee increase, a revision to the plumbing fee, and a permit reactivation fee. Suggesting we'd like to move up the demolition fee for residential lots from $45 a lot to be $50 a lot. As you can see, we called other municipalities. You see Auburn, Albany, Augusta. We talked to Macon, Bibb County, Savannah. We called other cities to kind of see what their demolition costs were. So just bumping ours up, it's currently at $45 to bump it up to $50. We didn't want to push it out too far because we still want to incentivize homeowners themselves to be able to come in and take care of their own properties if they see fit to demolish them.
Mr. Chair.
Yes, ma'am.
Would you, as you go through these, tell us what these are used for? I mean, in order to charge the $50, the demolition fee is charged to when do you charge the demolition fee?
Oh, when the owner comes in and they want to take care of the property, they want to tear it all down. So that's when they incur that fee. They come in, they tell us what they're tearing down, the location, proof of ownership, and then we proceed to allow them to tear the building down. We come out to inspect to make sure they're not leaving debris, they're not leaving material all in the road as they're tearing the property down, erosion control measures and things like that.
Okay, so the owner, property owner pays that fee when
ma'am.
they demolish?
Yes, ma'am.
Okay,
Permitting fee.
Correct.
permit fee.
That's
Okay,
correct.
great. And if you'd sort of give us that with each one of these, just
That'd be fine.
when is it used and how, who pays it, that sort of thing?
Yes,
Thank
ma'am.
you.
All right. The next one is the plumbing fee revision. I'm going to probably get a lot of flack from some plumbers. Typically, when we do, when the trades, you have your building permit, but then you have your electrical permit, you have your mechanical permit, you have your gas permit, and as those subcontractors come in, they have to pull permits. Now, I wanted to clarify this because the way it is in the system, it's a bit of a gray area. The way the permit is written up now is per system. So if it's a residential situation, say residential plumber's coming in to do some work on your house, he only pays $50, and there's no issue there. The issue comes into multifamily apartment complexes and things like that. So say if an apartment complex comes in, I'm going to skip ahead real quick and I'll go back. See if you got an apartment complex here, you have 4 different units in that apartment complex, for example. The plumber only pays $50 for that whole building. But my electrical guy, he has to come in, he pays $200 because that's 50 times each unit. My mechanical guy coming in to put your HVAC system in, he's $50 per unit. I have my gas guy, if you have a hot water heater, all that kind of stuff, he has to pay $50 per unit, but the plumber only pays $50 for the whole building. So it's just to even that out. We've gotten complaints from the electrical subcontractors for them to complain about why are they getting away with that, or why do they pay less. Long story, with the building the way it is, if you do a system that way, you have all your cleanouts and chases. Technically, it is all a part of one system. But my inspectors still have to come in for the rough ends. They have to check the toilets. They've got to come in and check the shower heads. They've got to check all of those plumbing fixtures, even though they're only $50 is all we're getting as a permit fee. So it's just to balance the field with all the trades that they all pay $50. It'll be per meter because we'll go back real quick. Back in 2012, the Georgia Water Stewardship Act went into effect, which means all new buildings and new apartment complexes that are built have to be sub-metered. So therefore, that $50 per meter would apply to each unit. All right, and then my last one, it's the, we want to call it the permit reactivation fee. During construction, typically permits expire 180 days after no activity. What happens is the contractor, for whatever reason, stops working on a project. Either it's funding from the bank loan, however it was, doesn't come through. So after 6 months of inactivity, we typically void the permit. When we void the permit, the trick now is that technically we could double fee the owner coming back in after that 6 months. We could say, hey, you have to pay that full permit fee. Take, for example, if the house valuation which the owner gives to us is $180,000, that's $856 that owner would have to pay again after that permit expired. So we either choose to double fee them, which we choose not to do. So what we've kind of done in the department is we issue an alterations permit. But at the end of the day, the alterations permit is not a good idea because the tax assessor is saying, how are you altering a house that's not even on the tax roll yet? So to try to clarify that, we're going to take that alteration out, and alterations permits will still be available, but you'll just have to reactivate the fee for $75. So we would keep the permit open. We would close it, and then it would be reopened for that fee, but instead of charging that same homeowner or developer $856, like I said, for example, a $180,000 house to come back in, he only pays $75 to reactivate that same permit. So we can keep it open in our system, and we don't have two concurrent permits going against each other.
Excuse me, John. Councilor Davis?
Yes, Director Hutchins, what would be considered inactivity?
Typically we get a few, it's just the homeowner, like I said, they may have started a construction project, and either because they're self-performing the work, say that they couldn't afford the trusses, or they couldn't get the shingles, or whatever specialty material they were doing. If there's no activity in any of the trades, from electrical, plumbing, mechanical, or building, we would void the permit. And so, because there's no work to be done, therefore our guys are going out there every 30 days to check on this property, and there's nothing going on. So our manpower is just being wasted going to a property where there's no work going on. So after 6 months, we void the permit.
I thought they're automatically going out every 30 days? I thought they were called out.
Well, they were called out for certain permits, but if they're inactive, we keep a book. So as everything comes into InterGov and it's logged in, if our guys, if it's a slow day like today, if it's raining, a lot of guys, we may not have any slab permits or any footing permits, they'll check some lower projects that it's been a while that there haven't been any work on. So they go by, and it's also logged in the computer to tell them there's no activity being done. So 30 days is generous. Usually it's between 45 and 60 just because we haven't enough active inspections going on. But if they do get a day where they don't have a lot of inspections, they do review old projects. And a lot of those we start expiring because they're projects that were started in 2013 or 2014. And we're just getting them, clearing them off the books because there's no work going on.
Does it, am I right, would it seem to affect more, instead of spec type development, it would affect more complex and custom type development?
Not necessarily. Like I said, we get all kinds of issues where people come in, or either the shipment of material didn't make it, or they're changing design, or, like I said, mostly it's just lack of funding. Contractors or small-time contractors, not big, huge ones, but they'll come in and they don't have the funding to finish the project. So either they allow it to expire, and then they'll come back in a year and say, hey, I have the funding to finish this project. So like I said, you know, like you mentioned, like a spec house, if you're saying it's going to cost $180,000, we wanted to do it within the last 2 years. So we don't want somebody coming from 2007 saying, hey, I need to reactivate my permit because codes have changed. So we want to do it within the last 2 years to keep some kind of cap on it to be able to control what's going on. So they would come in and say, hey, you know, we want to reactivate this permit, and we would charge them the $75 to do so.
Is this type of activity happening on a regular basis?
No, sir. Probably throughout the year, we probably get between 20 and 30. So it's not a lot, but it's just something to catch that. So when the tax assessor's looking at the tax rolls at the end of the year, like I said, the big question is when we do alterations to that permit, because that's the only way we can officially reopen it without charging them a full fee, then it gets all messy. So I'm just trying to streamline that process.
Thank you, sir.
Thank you. Any other questions? Thank you, sir.
All right.
Mr. Chairman,
Yes, sir.
I don't mean to bore you all with my accolades to an exciting staff, an exciting team, but you know, he's a brand-new director. It's not 30 days old, but as you can see, he knows his craft, he's skilled, and I'm excited about what he's going to be able to do for inspections and codes in the city of Columbus. I just needed to take a moment to thank him and congratulate him and point out to you all that we have great staff, a great team.
That's not really a surprise to us, and he survived his first budget session relatively unscathed, so we cut him some slack this time. We are glad you're in the position you're in. We're looking forward to some great things.
All right. Thank you.
Oh, I'm sorry, hang on. We've got Councilor Barnes.
Yeah, you know, I didn't waste no time now. You don't have a short memory. I didn't waste any time for it. See, it doesn't take me long to recognize that potential, just like Laura.
Mayor Pro Tem?
Good afternoon. Do you know approximately how many houses we have that need to be demolished that we don't have on the list yet?
We currently have 103, and we had a demo hearing last Wednesday, and we just added another, 25 of those 27. So that brings you about 130. And like I said, every month, depending on the status of those houses, kind of piggybacking off of what Laura mentioned. Part of my demolition budget this year is also to, we approved the boarding of some of these houses, so necessarily we don't get to the point where we have to just tear them down altogether. There's an opportunity where we're establishing the criteria that we could there'll still be a lien on the property, but we'll be able to board them up and safe them until the point where somebody may want to develop them.
Okay. How long do we hold the lien on a house before we go in and sell it to get our money back?
When we do a demolition, we put a lien on the property.
Okay.
And so at this point, we haven't we've looked at going through a foreclosure process, and at the time that happened, this was several years ago, it was not beneficial. The Land Bank Authority has been reactivated, and it's something that we've kind of put on our project list, is to determine if there's a better process for recouping our funds after we go through a demolition, because we have several million of dollars of demolition liens that obviously if they weren't maintaining their property, paying a demolition lien is probably not a top priority as well. So we are looking at how we can recoup some of our funds and get those properties back on the tax roll.
So you're going to bring us something in the next 6 months?
Yes,
Some
ma'am.
kind of recommendation? Because I feel like it's a lot of properties that we've had on the demolition list and nothing has ever happened. After it's torn down, we have a lien that's sitting out there.
And we think maybe the land bank might be a really good option for us to consider. And Councilor Henderson came to a debate or a public meeting, and we talked about a blight tax, which they have in Albany. And so Laura is looking into that as well. So we are looking at what we can do to recoup some of those funds.
Do you know how long Albany and other communities hold liens before they actually act on them?
That is not something that I know, but we'll definitely provide that back to council with a recommendation.
Thank you.
Thank
And
you.
I believe it was Councilor Davis who asked for a list of all of the liens we have on properties throughout the county. And I think we either emailed that or we have it. Tiasha Johnson is saying we didn't email it, but we do have that list. They sent it to me, and we are going to be providing you all with that list. And then we are going to be looking at how we can deal with that list of liens. We've got a lot of liens on property throughout the county, and
It would be interesting to see what percentage of those liens are recovered, because I would imagine it's very low. And I know on so many occasions, when we have a demolition, the cost of the demolition and the lien amount is higher than the lot is worth. So rather than it sit there, maybe incorporate into your study a recommendation, getting it to one of these philanthropic organizations is somebody that'll get it on the tax rolls and earning taxes again. Because we had a situation the other day where a woman wanted to buy a lot, and the lot was, frankly, because of the liens that were on it, it wasn't worth what we had to pay. She had to pay to get it done. So, Mayor Pro Tem, I don't think was finished.
And that's my point. Especially if my house is that house next door to that property that we had a lien on it because they didn't keep it up. And boarding it up is not helping a lot of times. And when you have snakes crawling over your property because the property is unkept, I just think we need to get real busy on them.
Thank you.
Well,
Councilor Davis?
Well, Mr. City Manager, I'm glad you brought that up. Thank you. Restored my confidence. I thought you forgot about it. I'm just kidding. But Mr. Budget Chair, I think we do have a vehicle in place to do exactly what you stated, which would be a concern as well. My question, I want to go back to Director Hutchinson, and just on the plumbing fee revision, is it correct for me to be accurate in saying that I don't know if the Georgia Water Steward Act that you're talking about, or the Columbus Water Works, is there now a meter required for all sprinkler systems?
That would be more of an irrigation system.
Irrigation system,
Yeah, they
correct.
have backflows, and we check the backflows, but most of that stuff is installed by private.
They don't have to be metered.
Well, I'm not sure. I know for buildings, I know our stuff does, and people choose to separate the meters. You can separate them, but I don't know in all cases that they do.
Okay. If they would, under this act, or by the waterworks now, and they've gone through, I know the backflow preventers are extremely important, and they're strict to the text on that. But would this equate to, right now, it's per system, which would be $50, but if you do have to add another meter, then you're talking about, for an irrigation system, I'm assuming that would be on how many permits per year?
Irrigation, that probably would be somewhere between 600 and, depending on if they're new developments, so around probably 500 to 600 permits.
So if that's the case, you'd be looking at 2 fees for 2 meters.
That's correct. So like I said, in that case,
Per unit or per house?
Well, it's mostly on multifamily housing, because those are the ones that used to just, the older just had the master meter, and you had nothing, everything ran to the master meter, and then they divided it by the tenants, and then that was your bill you paid. So with the Georgia Water Stewardship Act, that was a state law. It's not through IBC or anybody else. That's a state law to sub-meter for multifamily and commercial buildings. So residential, I'd have to get with the waterworks to clarify on the meter layout and backflow with irrigation. per se. But I know
Is the
specifically.
city inspectors inspecting the irrigation systems, or is
No,
it
sir.
waterworks?
No, sir, because that's not a part of the building structure. It's part of the site development, but we wouldn't inspect it.
But we would charge for an extra meter.
Well, that's what I have to clarify with the waterworks to make sure, because we wouldn't, it's something we would inspect, so I wouldn't assume for us to charge for a meter is something we don't inspect.
Okay. Thank you, sir.
Councilman Baker?
Thank you. And congratulations on the new appointment. This isn't a budget question, so I really won't hold you up, just when you have time and get things under your feet, ready to take a look. I've had a call from a couple of the tradesmen. They've just run into an issue to where if, for example, there happened to be two owners of a piece of property, and one owner called a tradesman out to a repair, and he went and bought his permit, bought his materials, went by and checked on the job, and set it up for the next day. In the meantime, the other owner had called worker, and he did the same thing. And they both showed up on the same job with a permit and materials and time and cost and all involved. And I don't think those permits can be refunded, or is there a way they could be set up for credits? It's one of them was out, a permit fee, material cost, time. Obviously an owner can hire whoever they want. I'm not going to get in the middle of that. But if there's maybe a notification process, if within a very short time frame, two identical permits are bought at the same address for the same job, if there's just perhaps a notification to say, hey, we don't know what's going on, but y'all need to get this straight because we don't want there to be a problem. If you would just give that some thought as you go forward. It sounds like you're going through your processing a little bit, and just see if we could come up with some ideas in the future. Yes. Thank you.
All right. Thank you. And one other thing I was going to mention, Deputy City Manager Hodge talked about that public hearing, and we did ask about the blight tax for landlords that are repeatedly fined for the same type of violation, and maybe impacting their ad valorem taxes and trying to capture some money and then funnel that directly back into either the demolition process or some other community reinvestment type activity. But we also were asking, I know we have a lot of maintenance type liens. In other words, if the grass gets overgrown and it's an absentee landlord, maybe they inherited a piece of property and they haven't done anything with it and they live out of town, and we'll go take care of the property, and then I think we put a lien on that property. I have no idea what the percentage is. It's got to be a very small percentage-wise, but it may be pretty good size from a dollar's perspective if we engaged a collection agency. We did it on parking fines and try to recover some of these revenues from people who do have the ability to pay, and just because they don't live next door to it or live near it, it's out of sight, out of mind.
And we do utilize a collection agency for the weed liens.
Okay.
But we get very little response even through the collection agency, but we do utilize one.
Okay. John, thanks.
And the last department on the agenda for today is Fire and EMS, so I'll turn it over to Chief Meyer.
Good afternoon.
Welcome, Chief.
Now, I'm used to coming here and telling you that I need several million more dollars because we're about to have to shut down, but that doesn't seem to be the case this year, thank goodness.
And you can stay.
It's still early, I know. I'm trying to go modern and use this iPad here. We'll see if this, I doubt this works, but we'll try. We were asked to come today to talk about the recommendation for fee increases for the department. It's been several years since we reviewed our fees. The first thing we did was pull up state law, official code of Georgia, annotated title 25. And 25-212 states that jurisdictions of our size have to adopt the state's minimum fire safety standards. Of course, we have done that in Columbus. It's not something we have to do every year, but it is in our code of ordinances. Title 25 also gives CCG the authority to charge and retain appropriate fees for the services that we provide when we go out and conduct these life safety code inspections. So in front of you is a list of the old fee and the recommended fee. We contacted the state fire marshal's office, so our recommended fees are pretty much in line with theirs. They do charge more in some instances, and we didn't see the need to do that. Again, it's been almost 10 years since we've increased these fees. These aren't fees that the homeowner would pay. This is more developers or business owners, folks that own or want to start up personal care homes. In the past, and if you look down the list, it may be the 7th or 8th down the list, is what we call a small personal care home, is personal care homes with 6 or less occupants. We haven't been charging anything for that. And we probably had a couple hundred last year. So it's taken us time. And really, when I talk about an inspection, that's 2 times. That's 2 visits. We usually have to go out there one time and meet with the owner, recommend to them, inform them on the things that they need to do to meet the minimum standards. The next visit we go out, hopefully everything's taken care of, and we can sign off on that, and they can get their permit from the state. If we can't sign off on that, then there's other visits after that that we're going to have to go out to the property to make sure they meet the minimum standards. We're projecting that with the fee increases that our revenue stream should increase by about 50%. Just looking at what we've done historically, should keep up again this year. We also did look at Cobb County to see what they were charging. What we found out was jurisdictions are doing everything across the board. The way we operate in Columbus, John's group does certain things when it comes to construction, and the fire department takes care of other things, sprinkler systems, fire alarm systems, egress, fire extinguisher placement, vent hood inspections, and we work really well together. So we think these, I will have to say, when I first looked at them, I thought, man, guys, these have really gone up. But looking at what they got from the state and other jurisdictions in Georgia, we're pretty much in line with these new recommended fees.
Any specific questions on any of the fees? Councilor Thomas.
On the, excuse me, the fire report fee that you're going from 3 to 5, is this for insurance purposes you get a report? Is that generally what that is?
Generally it is. Now, if we have a homeowner that's had a fire, we don't charge them. They've experienced enough loss, so if they'll come to us, we just give them that. But if we have maybe somebody that owns rental property, something like that, commercial business, we'll charge them the $5.
Luckily, I have not had to experience getting a police report, so I don't have any idea how much they charge for a police report. Is it about this amount, or?
I'm lucky like you. I have no idea. I haven't had to get a fire report either, so I'm not sure.
And I'll have to check on the fees to make sure. I'm not off the top of my head sure what they charge for a police report.
It just seems to me that those two reports are very similar in use and so forth, and I'm willing to bet you they charge at least $5, if not more than that.
And we could look at increasing
And luckily,
that.
I haven't had to have a fire report either.
Good. You did have a good article the other. I read that yesterday. That was a good article.
Thank you, ma'am. Oh, Chief, any other questions for the chief? Chief, appreciate what y'all do. Sure do. All of y'all.
Thank you.
Thank you.
That concludes the agenda for today. The next scheduled budget review session will be next Tuesday, immediately following council meeting. The departments that we currently have scheduled is Parks and Recreation, Planning, Engineering, and IT will be with Engineering to answer any questions about the transfer of the GIS division, the Trade Center, and Recorder's Court.
And I was asked by a member of the Budget Review Committee if it's appropriate to invite somebody here if they have questions, and it absolutely is. It might help, though, if there's specific questions, if you can get those to them ahead of time, they can come prepared to answer them. So if anybody would like a department head to appear, if we'll just let Deputy City Manager Hodge know, and we will try to get them on the agenda. If there are no other questions or comments, we are adjourned.